Welcome to aminacademy.com. In abnormal psychology, let us discuss about eating disorder, that is anorexia nervosa, some case studies. Anorexia nervosa, often simply called anorexia, is a treatable eating disorder in which people have a low body weight based on personal weight history. Although many people with anorexia look very thin, some may not look thin and others may look overweight, but they have actually lost weight or failed to gain needed weight. People who have anorexia often have a strong fear of gaining weight and may think they are overweight, even when they are thin. To prevent weight gain or continue to lose weight, people with anorexia often limit the amount of type of food they eat. They place a high value on controlling their weight and shape and use extreme effort that can greatly harm their lives. Anorexia can cause changes in the brain due to very poor nutrition, also called malnutrition. This is when people don't get the nutrients that their bodies need to stay healthy. So it's not a choice to continue the risky and damaging behavior. If let's understand if left understand, weight loss can get to point where people with anorexia are at high risk of serious physical harm to death. Anorexia has the second highest death rate of any mental illness, surpassed only by opioid overdoses. Most deaths related to anorexia stem from heart conditions and suicide. Anorexia, like other eating disorders, can take over people's lives and be very hard to overcome because it's related to changes in the brain. Anorexia behaviors are not choices, and the illness is not really about food or looking a certain way. With proven treatment, people with anorexia can return to a healthy weight, develop more balanced eating habits, and reverse some of anorexia's serious medical and mental health complications. Some symptoms. The physical and behavioral symptoms of anorexia nervosa relate to how starvation affects the brain. It may be hard to notice symptoms because what is seen as a low body weight differs for each person. Some people with anorexia may not look very thin. Also, people often hide their thinness, eating habits, or physical problems. Some physical symptoms. Physical symptoms of anorexia nervosa may include irregular heart rhythms, low blood pressure, and dehydration. Dehydration happens when your body doesn't have enough water and other fluid to carry out normal functions. Your fingers may look blue and you may have dry skin. You may notice a change in your skin colors, such as yellowing of the skin. You may have hair that thins, breaks, or falls out. You also may have soft, downy hair covering your body. Some other physical symptoms. Extreme weight loss or not making expected weight gains based on age, being very tired and weak, dizziness or fainting, having a hard time passing stool and having stomach pain, not able to stand the cold or feeling cold when others feel fine, swelling of the arms or legs, wearing away of the teeth and calluses on your knuckles from causing yourselves to vomit. Stomach aches, never feeling hungry or feeling hungry and getting full right away after eating a very small portion. Having a hard time concentrating or focusing. Low mood. increased anxiety, stress fractures, or reduced bone mass. Some emotional and behavioral symptoms. You may have an extreme focus on food. Sometimes this includes cooking meals for others but not eating those meals. You may skip meals or refuses to eat. You also may severely limit the amount of food you eat through dieting or fasting. Not admit to being hungry or make excuses for not eating. When you eat, you may eat only a few certain safe foods, often foods low in fat and calories. You also may focus too much on eating clean or healthy and stop eating specific types of food in a way that has not been recommended by a healthcare professional. Now, let us discuss further detail about anorexia nervosa, some case studies. Anorexia nervosa, a type of eating disorder previously uncommon in India, is now on a steady rise due to globalization and increasing cultural westernization. The following case represents an unconventional presentation of a symptoms to add to the scarce extant Indian literature. Some case presentation. A 14-year-old girl with history of amenorrhea, compulsive exercising, and restricting food intake had come for treatment with a significantly low BMI, nearly about 10.6 kg per meter square. She was immediately admitted for refeeding. Psychometric assessments were also conducted. She was diagnosed with anorexia nervosa, restricting type, and initiated on adolescent focused psychological interventions. Family focused interventions were also provided with the involvement of the parents after careful assessment of family dynamics. Within a period of 8 months, amenorrhea abated and her BMI reached 18 kg per meter square. And anorexia nervosa with compulsive exercising, it is beneficial to provide a cognitive behavior therapy, nutritional rehabilitation, and family focused interventions parallelly, as it would induce an expeditious reduction of overall ED severity and improve treatment outcome. Anorexia nervosa, eating disorder, cognitive behavior therapy, refeeding, family focused interventions. Anoro- Anorexia nervosa (AN) is a eating disorder indicated by intense fear of gaining weight, restriction of energy intake, and persistent behaviors that inhibit weight gain. Anorexia in India has a prevalence rate of this much percentage, 0.063%, in children and adolescents with a female male ratio 5 is to 1. Female is higher. Since in 1990, the occurrence of AN has seen a steady increase due to varied factors such as globalization and targeted advertisements, resulting in an estimated loss. Case presentation. A 14-year-old girl from Chennai studying 10th grade was brought for psychiatric consultation with history of continuous and progressive weight loss of 19 kg in 9 months, Lonugo amenorrhea. and compulsive exercising for 8 months. Patient was apparently functioning well until the start of ninth grade. Due to the increase of her schoolwork, she had stopped badminton classes and started working out at home using a fitness app. Around this time, due to a rift with her best friend who no longer spent lunch breaks with her, she started throwing away food. Her family noticed an onset of obsession with the need for exactness and ordering, arranging compulsions. With the start of the pandemic lockdown, classes were shifted online. She insisted on taking up household chores and performing it in peculiar ways to maximize physical exertion. For instance, she would place a bucket of washed clothes at one end and the end of the terrace, run up and down to pick up articles one by one and put it to dry. The other overt behaviors that she developed for the purpose of weight reduction were secretive eating to throw away food, looking up quantity of calories in her food online, weight checking, drinking large amounts of water before and after food, and doing jumping jacks even while attending classes. She also engaged in convert methods such as standing majority of the day for better digestion. She used to play football in the evening with her friends but stopped when they started noticing and commenting on her weight loss. Movements and speech progressively slowed, and irritability increased, and frequent outbursts directed towards her parents. Until relative insisted on it, her parents had not realized the requirement for interventions. In the pretext of going elsewhere, they took her to a psychiatrist who prescribed medications. Due to the high sedative effect, she discontinued it within 3 days. After being coerced by the parents to stop doing the jumping jacks, she began doing high intensity yoga asanas, which consisted of repeated cycles of Surya Namaskar. When the parents saw no improvement in her weight, they convinced her to again consult a psychiatrist. In the waiting room, she was found performing Surya Namaskar. She weighed 26 kg, BM is 10.6 kg per meter square, and was admitted for nutritional rehabilitation. She was assessed using various psychometric scales such as Yale Brown Obsessive Compulsive Scale, Eating Attitudes Test, Compulsive Exercise Test, projective tests such as Draw a Person Test, Draw Yourself Test, and Draw Your Family Test were also done to analyze self perceptions and family dynamics. She was diagnosed with AN restricting type and initiated on psychotherapy, pharmacotherapy, while family based interventions were also provided. So far, we discussed a little about abnormal in psychology, eating disorder, anorexia nervosa, some case studies. We have done. Please subscribe our YouTube channel.